Lymphangioma of the leg is Lymphangiography of the leg is performed by dissecting lymphatic through an incision on the dorsum of the foot. Finding the cause of unilateral lymphedema of the leg includes taking a family history, looking for chronic infection in the foot, looking for filariasis. Treatment of acute lymphangitis requires antibiotics and rest. Total dose of radiation in Hodgkin's disease is 3000 to 5000 radiations. The most important prognostic indicator in the Hodgkin's lymphoma is none of these. Diagnosis of Hodgkin's disease is confirmed by lymph node biopsy. Grade 1 lymphedema means edema disappearing after overnight rest. Lymphovenous anastomosis is done for filarial lymphedema. What is true about lymphangioma? It is a congenital sequestration of lymphatic. Cystic hygroma is a lymphangioma. The most common site of lymphangiosarcoma is post-mastectomy edema of arm. Commonest cause of acute lymphadenitis in India is staphylococcal skin infection. All of the following soft tissue sarcomas have a propensity for lymphatic spread except neurofibrosarcoma. So which soft tissue sarcoma have propensity for lymphatic spread? Synovial sarcoma, rhabdomyosarcoma and epithelioid sarcoma. But neurofibrosarcoma does not have propensity for lymphatic spread. A 40-year-old man presented with a flat 1 centimeter by 1 centimeter scaly, itchy black mole on the front of thigh. Examination did reveal any inguinal lymphadenopathy. The best course of management would be excisional biopsy. In India, what is the most common cause of unilateral lymphedema of lower limb? Filariasis. Lymphovenous anastomosis is done for filarial lymphedema. All are true about cystic hygroma except pulsatile. So it is not pulsatile. Cystic hygroma may cause respiratory obstruction, common in neck and present in birth. What is true about lymphedema? Lymphangiosarcoma may occur and AAV Milroy's disease. Trauma. Treatment of choice for stab injury of cecum is iliotransverse anastomosis. Blunt injuries to the abdomen rarely need urgent laparotomy. Hemostasis in scalp would be best achieved by direct pressure over the wound. In penetrating injury of abdomen, commonly affected is small intestine. Initial treatment in a management of trauma is airway. Death in blunt trauma chest is due to tracheobronchial injury. A 12-hour-old bullet injury to the left colon is ideally treated by resection of affected segment with upper segment colostomy and lower segment as a mucus fistula. What is the management of a case of bullet injury to left side of the colon presenting at 12 hours after incident? Proximal colostomy and bringing out the distal part as a mucus fistula. Which one of the following vein should be avoided for intravenous infusion in the management of abdominal trauma? External jugular vein. Which one of the following is not a part of the revised trauma score? Pulse rate is not a part. Which are the parts? Glasgow Coma Scale, systolic blood pressure, and respiratory rate. In severe injury, first to be maintained is airway. Most common abdominal organ injured in blunt trauma abdomen is spleen. Investigation of choice for blunt trauma abdomen in unstable patient is USG. A 30-year-old female comes with hypovolemic shock after blunt trauma of the abdomen and emergency USG of abdomen shows splenic tear. Which of the following is to be done? Immediate surgery is to be done. In traumatic transection of the femoral artery and vein, which among the following should be done? Femoral artery repair with vein ligation and repair of artery and vein. A patient's sudden headache and vomiting and unconsciousness, the diagnosis is subarachnoid hemorrhage. Commonly injured in blunt abdominal injury is proximal jejunum and ileocecal junction. In traumatic injury to common femoral vein and external femoral artery, which among the following should be done? Repair of artery and vein. After sustaining trauma, a patient developed persistent hypotension with CYP 16 mm, H2O with B blood pressure of 90 by 60 millimeter of mercury and pulse of 140 per minute. The diagnosis is cardiac tamponade or tension pneumothorax. A patient developed hemoperitoneum following RTA with blood pressure of 90 by 60 and pulse 140 per minute, which of the following is to be done? USG is better than CT scan and urgent surgery to be done. A patient after sustaining RTA develops fracture of left shaft of femur with guarding and rigidity in the abdomen. Following is to be done: X-ray of lower limb and USG abdomen, start IV fluids, Ryle's tube and catheterization, grouping and cross-matching of 2 units of blood. A 30-year-old gentleman after sustaining road traffic accident presenting in emergency with blood pressure of 100 by 60 mm of mercury, pulse is 120 per minute, and CT scan shows splenic laceration at inferior border after 2 units of blood transfusion. Patient condition are blood pressure 120 by 70 mm of mercury and pulse is 84 per minute. The next line of management is continue the conservative treatment and take subsequent measures on monitoring the patient. A person following a road traffic accident presented emergency with laceration of iliac. On examination, there was swelling of inguinal region and distal pulsation was felt. Internal iliac artery was normal. Common iliac and external femoral artery was normal, but common femoral vein is transected. Treatment of choice is vein repair with continuity. Which one of the following is not a principle followed in the management of missile injuries? Removal of fragments of bone. Seatbelt causes injury to duodenum. All of the following are used for gradation of coma is Glasgow coma scale except heart rate. So it includes eye opening, motor response and verbal response. Mild head injury is having Glasgow coma scale of 10 to 15. According to the Glasgow coma scale, a verbal score of 1 indicates no response. Which of the following is not a component of Glasgow coma scale? Pupil size is not a component. Eye opening, motor response and verbal response are the components of Glasgow coma scale. Total score in Glasgow coma scale of a conscious person is 15. Protein metabolism after trauma is characterized by the following except inhibition of skeletal muscle breakdown by interleukin 1 and tumor necrosis factor. So what is protein metabolism after trauma? Characteristic features: increased liver gluconeogenesis, increased urinary nitrogen loss, and hepatic synthesis of acute phase reactants. Abdominal compartment syndrome is characterized by the following except oliguria due to ureteric obstruction. So abdominal compartment syndrome is characterized by hypercarbia and respiratory acidosis, hypoxia due to increased peak inspiratory pressure, and hypertension due to decrease in venous return. Preferred incision for abdominal exploration in blunt injury abdomen is always midline incision. A patient sustained traumatic injury. To measure abdominal vessels, it has been planned to explore the suprarenal aorta, the celiac axis, and the superior mesenteric artery and the left renal artery. What maneuver for exposure is recommended? Left medial visceral rotation. Best prognostic factor for head injury is Glasgow coma scale. Base of the skull fracture presents with involvement of the petrous temporal bone. Which of the following is important sign? Battle sign. Diagnosis of traumatic rupture of diaphragm is through laparoscopy or chest X-ray. What is the first step taken in case of multiple injuries of face and neck? Maintenance of airway. A male patient with blunt trauma abdomen is hemodynamically stable. What is the next line of management? Further imaging of the abdomen. A young patient presents with a massive injury to proximal duodenum, head of pancreas and distal common bile duct. The procedure of choice in this patient should be pancreaticoduodenectomy, that is Whipple's operation. What is true about blunt abdominal trauma with splenic rupture? Spleen is the most common organ to be involved. What is true about abdominal compartment syndrome? Cardiac output, urine output and venous return. True about diaphragmatic injury, advised diagnostic laparoscopy, chest X-ray is useful. Late complication is herniation of abdominal content. A person after pelvic fracture could not pass urine. On examination, bladder is not palpable. What is probable diagnosis? The probable diagnoses are intraperitoneal rupture of bladder or extraperitoneal rupture of bladder. A man comes to emergency with stab injury to left flank. He is stable. He has stable vitals. What would be the next step in management? CECT. A man with blunt injury abdomen after roadside accident has a blood pressure of 100 by 80 millimeter of mercury and a pulse rate of 120 beat per minute. Airway has been established and respiration has been stabilized. Next best step in management is blood for cross matching and IV fluid. Which of the following is used to define penetrating neck injury? Breach of platysma. Glasgow Coma Scale include eye opening, verbal response, and motor response. What is true regarding presentation of thoracic duct injury? Electrolyte disbalance, lymphopenia, dehydration, and chylothorax may be present. What is true about indication of ciliotomy in blunt trauma? Peritoneal air-on imaging, severe hypotension, and grade 1 spleen damage. What is the investigation of choice in a patient with blunt abdominal trauma with hematuria, contrast enhanced tomography? Traumatic diaphragmatic injury except small tear heals spontaneously and surgery is not required. Mask ventilation is encouraged in patient with massive visceral herniation. Both are incorrect. So traumatic diaphragmatic injury is left side rupture due to weak left hemidiaphragm at point of entry of embryonic origin, most commonly due to trauma, and abdominal approach is most favored. All are true about flail chest except paradoxical movement may not be seen in conscious patient is wrong. What is true is fracture of at least 3 ribs. If overlapping of fractured ribs with severe displacement is seen, then patients are treated surgically with open reduction and fixation. PaO2 is less than 40 with FiO2 more than 60, treated with intubation and PEP. In a patient with head injury, eye opening is seen with painful stimulus, localizes the pain, and there is inappropriate verbal response. What would be the score on Glasgow Coma Scale? 10. Blunt injury abdomen patient was hemodynamically stable. Next investigation is fast. Commonest organ injured in blast injury is lung. In blunt trauma abdomen, what should be the approach for doing laparotomy? Always midline incision. Best prognostic factor for head injury is Glasgow Coma Scale. In order to expose the celiac axis, left renal artery, superior mesenteric artery, and abdominal aorta, in a case of trauma, which of the following is performed? Left medial visceral rotation. A man with blunt abdominal trauma with history of pelvic fracture has presented to ER. He has passed only few drops of blood per meatus and no urine in the past 8 hours. His bladder is palpable per abdomen. Which of the following is correct? Urethral injury. According to the Bismuth-Strasberg classification, cystic blowout is classified as type A. Trauma and injury severity score TRIS includes RTS plus ISS plus age. A 27-year-old patient presented with left-sided abdominal pain to the emergency room 6 hours after an RTA. He was hemodynamically stable and fast positive. Contrast enhanced CECT scan showed grade 3 splenic laceration. What will be the most appropriate treatment? Conservative management. A 27-year-old patient presented with left-sided abdominal pain to the emergency room 6 hours after an RTA. He is hemodynamically stable and fast positive. A CECT scan shows a contrast blush with a grade 3 laceration. What will be the most appropriate management? Splenic artery embolization. A lady presented to the emergency department with a stab injury to the left side of the abdomen. She was hemodynamically stable and a contrast enhanced CT revealed a laceration in spleen. Laparoscopy was planned. However, the patient's PO2 suddenly dropped as soon as the pneumoperitoneum was created. What is the most likely cause? Gaseous embolism through splenic vessels. Which of the following grading method is used to evaluate the prognosis or outcome after subarachnoid hemorrhage? Hess and Hunt scale. Initial treatment in the management of trauma is airway maintenance. Treatment of simple rib fracture includes all except strapping of chest. So treatment of simple rib fracture includes analgesic, physiotherapy, and early ambulation. Orthopedic healing is slow below the knee joint because of poor vascularity. In hand injuries, first to be repaired is bone. Bony metastasis in children is commonest with neuroblastoma. Reparative granuloma of jaw is treated by curettage. Clicking jaw is due to lax temporomandibular joint. Commonest site for chondroma in vertebral canal is cervical. Treatment of choice in giant cell reparative granuloma is curettage. The following bone tumor may cause dural deposits without causing bony changes. Hodgkin's lymphoma. Riding breeches deformity is collection of fat on over the femoral troncantors of the thighs. What is the percentage of patients who have undergone amputation which show phantom limb pain? 35%. Following an operation for hallux valgus, the most satisfied patients are those who had pain. In a case with infection in heel space, drainage through incision on plantar aspect of heel should be done. Psoas spasm not seen in lumbar TB, it is seen in septic arthritis hip joint, TB of hip joint. Dentigerous cyst arises from an unerupted permanent tooth. Porter's tip deformity is seen in Erb's paralysis.